20-minute presentation regarding such a broad topic. So I'm going to go through an overview. By no means this is in depth, and each one of these slides could probably be an hour-long talk by itself. So if it seems like we're kind of glossing over things, we are in fact doing that. The first thing I like to kind of cover is what the objectives here of this quick talk will be. One, I like to discuss the occurrence of flooding, and then particularly the risk it poses to South Carolina, the effects of globally sea level rise change, flooding, and extreme weather events, the impact climate change has on each of those topics, and then finally kind of tie it all together with the overall health impacts of each. So first, to define this is a problem. I like this chart here from DHEC and also the Emergency Operations Plan. In essence, there are 4 quadrants here, right? And yeah, the x-axis will be the probability of an extreme event occurring, and the y-axis will be the severity of said events, right? So the ones in the top right quadrant will be the ones of the biggest concern, for they're most likely to happen and most likely to have the most serious complications and consequences. And highlighted there will be hurricane and tropical storms, and in particular flooding there too, along with tornadoes. So all those are in the top right, meaning they have the highest probability and also a very high consequences of action. This isn't gospel by any means. Highlighting extreme heat, because it's one of my pet peeves, is that it's kind of underappreciated. So they have it as almost the lowest consequence on the list, where it takes lives every year. But anyways, so to kind of go through the reasons why and why there's increased events of all these, we're going to look at a couple different ways. So one is this heavy downpour increases, which this graph goes from 1958 to 2012, and essentially is confirming what we always kind of feel, is that there are more heavy downpour days. And I'm a stickler for data. When you break these down on more of a micro level, the 27%, 71% kind of edges out a little bit, where some areas are experiencing more, some areas are experiencing less. But in general, the overview is, yes, there are more wet days, and those wet days during the time frame are more severe at the time. Correlating with that would be this graph from off of Charleston. So this looks at sea level rise in feet, right? When I look at these events, I get a little busy, but when I look at projected scenarios, one of the first things I do is take off the top and the bottom, because essentially, even though we don't do a great job, we never quite do as bad as we think we're capable of doing, and we're never doing as good as we think we are either. So the bottom two kind of come off, but then even just looking at the middle few graphs, you'll see on average the expectation is about 2100 to have 3 to 4 up to 6 feet rise in sea level. So this graph, again, unfortunately, is from Charleston, because that's where a lot of the data is from, but is a graphical representation of what Charleston Peninsula will look like with just 3 feet of sea level rise. And I think that it's very impactful to see that areas that are habited or flooded, and that's not even including the incidence of nuisance flooding and the consequences of the heavy downpour now that sea level rise is there. Likewise, looking at Charleston again, the overall predictive minor coastal flooding in Charleston. So these graphs here each represent a correlating one from before. So again, taking off the top and the bottom is still very impactful, right? That you'll notice the top of the graph on the high and intermediate risk flatten is because that's every single day. So there's nothing worse, that you can't get any worse than having minor coastal flooding every day of the year. Even taking down the lower projected risk, we're still looking at 100, 150, 200, 250 days per year where they're experiencing minor coastal flooding in Charleston. Right now it's 50, and it's causing tons of issues already. Part of that, and tying into healthcare, not just is direct health relation of flooding, but access to care, which is something that I experienced more in 2015 with flooding in Lexington and Columbia, was simply getting patients to the hospital was more difficult. And again, Charleston again, but this graph represents the quote unquote nuisance flooding. So a general rainy Thursday, these areas are the ones prone to flooding. Superimposed on that is also the emergency routes taken for access to MUSC. So clearly, nuisance flooding, even if we call EMS, impacts how they actually transport you to the hospital, affecting directly delay of care. This is what it looks like. This was just a Thursday in Charleston. And I don't know if you guys are familiar, but there, that little bridge is about where the Hollings Cancer Center is. This is kind of a main thoroughfare into like the main area of the campus now, and that's the 6th Street, where it's flooded, and it greatly impacts health. This guy down here is actually wearing his mask, which is pretty awesome, but at the same point, he's wading barefoot through coastal flood waters in a hospital zone. With any talk with climate change, I also like to include social vulnerability because the two go hand in hand. This area, again, another DHEC site with a superimposed graph, but the social vulnerability gets darker, the sea level risk gets darker. So the areas that are darker in the purple and the maroonish kind of color are the ones with the high social vulnerability and also the highest risk of impact to sea level rise. And you can see the two superimposed, right? That essentially all of South Carolina has some degree of social vulnerability due to a myriad of issues. But those that are highest risk of being impacted by sea level rise greatly exceed the general number of the coast. Inland flooding. So a lot of what I talked about so far had to do with sea level rise, and Charleston in particular. This one was kind of close to me, was inland flooding, the 2015 floods here. One, just the scale of it. Red Cross delivered 150,000 meals, provided over 7,000 health and mental health services, provided almost 4,700 overnight shelter stays. Hospitals in the area were relying on shuttled water to continue running. 2 hospitals downtown were under a boil water advisory. And again, access to care due to the infrastructure was greatly impacted. I include this graph. It's really busy, and it's purposely busy to show the health effects of hurricanes. So again, big overview, but I think the media and in general, the population does a good job looking at the acute issues with hurricanes. But what we don't recognize is all the other aspects of where it impacts us. So, we see the winds, the storm surge, and precipitation on TV, and we look at power outages and injury. We don't appreciate what I highlighted is that a large degree of deaths related afterwards has to do with carbon monoxide poisoning for inappropriate use of generators. So you can kind of glance through the various health issues, but you see that this isn't just, the Cantori on TV event, but these effects go much longer than what we see on TV. 2 in particular, I'd like to highlight Hurricane Florence, Hurricane Matthew here. Just some raw data looking at the number of shelters open, the number of people provided shelters, the number of power outages, the number of water rescues, and then looking at the mortality reported with Hurricane Matthew, where there was a flood water incident. Looking at Hurricane Florence, again, overlying these 2 issues of social vulnerability and the rain recurrence interval. So these dark lines here is 1,000-year flooding numbers. Superimpose that over on the second graph of social vulnerability. You'll see that the areas of South Carolina with the least resiliency are the ones that are getting impacted time and time again with hurricane and with flooding. Another pet peeve is the underrepresentation of morbidity and mortality associated with hurricanes. So here was one looking at Florence in particular, and I included four from the article of individuals who experienced death. So, a 44-year-old who suffered an aneurysm after evacuating from Wilmington with her husband and two children. An 85-year-old retired electrical engineer who fell into a coma after a 13-hour car ride. A 65-year-old who died in his sleep of unknown causes. A 39-year-old who overdosed in a shelter. So deaths directly attributable, I believe, to the hurricane and its aftermath that are not reported. So that's where this bar graph on the side here represents the direct and indirect causes. Again, I would challenge this even goes further because this is reliant on reporting from emergency rooms and reporting on death certificates where they're inaccurate. So, carbon monoxide poisoning may be asphyxiation, heart disease may not be directly related. So, again, the total incidence of morbidity and mortality after these events are much higher than what we hear reported. So, bringing it back to climate change, I want to include this graph because I think it's impactful to look at what is the impact of what are we doing as humans to impact the rate of sea level rise. And you can see on this graph that just thermal expansion, so just the water getting bigger because of heat adds to it. The added water, which is the melt water, and the two added together is the driving force of man-made complications to sea level rise. And again, because I like pictures, you see these all over the place, but I think it's very clear of why we're seeing increased sea level rise when you look at such a total impact of melt across the glaciers in Greenland. And then finally, to kind of tie it back to public health and floods in particular, but this kind of overlaps into extreme weather events too, that like we discussed with hurricanes, this isn't just a acute event. And I would love hopefully to talk a little bit more later about the most common, I believe, complication from these, which is mental health and depression and anxiety, especially since I'm a pediatrician, and children who are displaced due to extreme weather events, and the impact that has not just 6 months, but also 6 years after these extreme events, which again is underrepresented since we don't routinely in healthcare connect the dots between the child we're seeing that is now being treated for depression and the fact that they were displaced from their home in 2015. So again, I try to keep it brief because it's a lot to kind of go through, and I want to make sure we had enough time to answer questions and to especially hear from April too. But thank you for your time.
Well, I'm assuming I'll go ahead and get started. Okay, great. So I too am going to share my screen. Good evening, everybody. I am so incredibly grateful to be here with you all to talk about flooding. I could talk about flooding all day long, all night long, and I do. My name is April OLeary. As Dr. Emery and Alicia so kindly introduced me as, I am the founder and president of Horry County Rising. We are a nonprofit, C4, which means we work really closely with elected officials and our local government, as well as our state government, as well as our federal government, to help prevent catastrophic damages to families caused by flooding. This is me in front of my home in 2018. Dr. Emery did a great job kind of talking about the impact that Hurricane Florence had on communities in 2018. So this is an example of a micro impact to a specific family on the coast in Horry County, and that was myself. Just wanted to kind of give you guys a little bit more of a visual. This really kind of shows the scale and scope in just one subdivision located in Horry County. And I thought it was really important to be able to share that with our members so you can really truly get a sense of what's happening during these rain bombs or during these major tropical storms. In Horry County, you can flood because of a beaver. You can flood because of an obstructed stormwater issue. You can flood just from rain. In fact, this year in February and March, we had 100 local roads that were closed in Horry County due to flooding, which was just caused by rain. And last June, we had folks actually paddling to the polls to cast their votes because they were flooded, they were inundated. So, in the coastal portions of our state, we're seeing a lot more increase in rain and a lot more impacts to families. As you can see in this subdivision, this is a fairly new subdivision. So one of the things at Horry County Rising we are working really hard to do is to prevent these catastrophic damages happening to future families that come to invest in the state, but also specifically in Horry County, looking at policies to really make sure that we have better flood protection measures, things like increasing the height of the homes. We just finished a campaign called Don't Build in the Swamp, where it addresses specific issues like that to prevent the type of impacts that you're seeing right now. So I know this is very traumatic to look at for a lot of folks, especially if you've been impacted. But it's also been sort of the precipitating event that really led to meaningful change. So I just wanted to be sure that I shared that. This gives you a sense, if you saw that, that was actually somewhat beautifully visual with the reflected homes all in the water on a sunny, beautiful day. But this is what happens after the flood. And this is oftentimes the visuals that you don't necessarily see. Oftentimes, typically what we see, in local journalists or newspapers is actually, all of the homes being inundated or the infrastructure being inundated or all of the activities that are happening ahead of the flood, but you don't necessarily see what it's like after the flood. And the reason why that's really important is that I wanted to give you a visual of what really leads to trauma or depression or anxiety. So in our particular case, we had a young son who was perfectly fine. Ahead of the flood event, he was great in Hurricane Florence. In our case, the floodwaters rose really slowly. So we had 3 days to prepare our homes. He was perfectly fine. Everything was great. We evacuated. We got him to a nice, safe place. He was really enjoying the new condo that we were staying at. Everything was great. But then when they actually, and I'm sorry, I didn't realize this had volume. But then when we actually got back into our community and schools were open, the schools have been closed for 2 weeks in Horry County. And they opened up the schools and we went back into our community. And this is the type of devastation that my son saw. And that really led to a lot of trauma. And just something that, a young child really isn't prepared to see. And so there was a lot of, talking through that and a lot of support with the school community and school professionals, and also obviously naturally at home. But it also compounds. So as you can imagine, several of his classmates were also experiencing very similar trauma based on these visuals alone. And we're having a difficult time. So, when we thought, our son was in an okay place, one of his school classmates was actually crying because her fridge was in the middle of the street. So those are the types of stories that we hear from, especially with young children. And it really took months for my son to actually smile again. I was telling Dr. Emery, he actually would build himself a little tent with a sheet, and it was his way of kind of creating a safe space or a secure place. And it took a couple months before he'd actually started to process really that trauma. So I think it's just kind of important to kind of show, what some of the communities look like after the flood and what it's like for families that are affected to go into these communities and see the devastation. One of the things that I think Dr. Emery did a great job talking about, and I won't spend too much time, is obviously, flood risk is increasing. In our particular case, our home had never flooded before. It was the first time that it had flooded, which was in 2018. But we actually have homes that are inundated anywhere between 2 to 4 times a year that are actually not in a defined special flood hazard zone as defined by FEMA. So in other words, they're not even required to carry a flood insurance policy. So by the time that FEMA updates the maps and those are adopted by the local municipalities or jurisdictions, families have already flooded 2 or 3 or 4 times in many cases. So, there really is no meaningful recovery or response when it comes to mitigating flooding. So right now we currently have about 55,000, a little over 55,000 to 60,000 properties that are at risk that have a very high potential of flooding over the course of a 30-year mortgage. That's a pretty significant amount. And obviously this is depicting how that increase is really being reflected in the numbers of properties. And so this year, we're kind of sandwiched in between the 48,000, 64, so around 60,000. But just in 30 years, we're going to see an 8% increase in the number of properties that are affected. Now, what does this mean in terms of cost, right? Those annual damages are increasing. So we're finding that a lot of families are paying a lot of out-of-pocket costs, which really changes their complete financial trajectory. And that's certainly what happened with our family. We lost all of our savings, even though we were covered and we had a flood insurance policy. So there's a lot of flood insurance policy doesn't cost, like temporary displacement housing costs, all of the different things that you have to pay for when you flood. And so there's a lot of significant amount of out-of-pocket costs that happen to families, especially if you are one of these repeated communities that are being affected multiple times a year. So you can just see, just in Horry County alone, annually, we spend about 18 million in damages. But over the course of the next 30 years, we're going to see a 72% increase, close to 30 million in damages. That's not really even calculating those extreme events like Hurricane Florence. So the numbers are much higher. We recently did a study to really analyze what those costs were for families that were affected in Horry County, partnering with Climate Cost Project. And what we learned is 30% of the families that were affected in 2018 did not receive any type of assistance, not any federal assistance or not any state assistance. So that is a really pretty significant portion of those that were affected and inundated, which was approximately about 2,000 families. 2/3 of those end up taking on debt to recover and rebuild. And about 30% of the families also lost all of their savings, a lot like us. And what we're realizing is that the federal assistance or the state assistance that is coming into these communities, only 7% of those funds are actually used to mitigate future risk. So what ends up happening is these families and these communities end up staying in this vicious, repetitive cycle that's really hard to get out because we're not doing anything to mitigate their actual risk. We're just rebuilding. So for an example, there's a home in Sockasty in Myrtle Beach that's probably worth about 150,000. But if you look at the number of times that family has flooded, the National Flood Insurance Program has paid out 1.5 million in claims and damages because they've flooded repeatedly. So that is really stressing, obviously, the family, but also we're spending billions and billions of taxpayers to rebuild homes without mitigating future risk. We also found that the majority of the families lost about 150,000 in personal wealth after a flood. That's even with a flood insurance policy. That's a pretty significant amount. And what we're capturing there is obviously like missed work, damaged vehicles, access issues, healthcare costs, all of those different things that Dr. Emery did such a great job kind of capturing. So what do we do? I don't have a lot of time to talk about Horry County Rising and our mission, but we do work really hard to prevent catastrophic damages to Horry families that are caused by flooding. We do this in a number of different ways, and I'm happy to present and come back another time and kind of talk about how we've been able to really partner with elected officials to do some more meaningful changes to both policy, but also to help mitigate future risk. But for the purpose of today, I won't be able to touch on some of those. But one of the things that I really wanted to drive home is that it was really, really important for families for us to be able to provide a forum for families to take action. One of the things that we know about grief and anxiety is the more that you can take action on that grief or on that anxiety, the easier it is to manage. And that was one of the things that I absolutely needed to do. So when I flooded in 2018, once I felt like my family was back and we were in a good place, I actually quit my job and created this whole organization around mitigating flood damages, because that was my way of being able to love thy neighbor. I was devastated and grief stricken by the scale and scope of the disaster in 2018. I had 500 neighbors that were inundated. And so these are neighbors that I care about, right? These are neighbors that I see on a daily basis. I'm surrounded by 2 widows. There was just a lot of grief and a lot of pain. And I knew that I really needed to be able to work through that grief. I needed to make sure that that tragedy that happened to our family and our neighbors, that we made something really impactful and meaningful that comes out of that. And that was my way of sort of working through the grief. And as I've worked with these thousands of families through Horry County Rising, and we have a Facebook group, you're more than welcome to join. But one of the things that we do is really try to take care of our families, and work together to make sure that we prevent future families that are investing in our county for suffering the same fate. So with that, I will end, and I'm happy to answer any questions. And thank you.
Thank you for sharing. I believe there may be a couple of questions either on Facebook or also some that may have been submitted earlier. So Marjorie, did you have any? And now I apologize, I did not introduce Marjorie Ann Foster, who is an intern with South Carolina Interfaith Power and Light. So she's been monitoring today and will help with the Q&A.
Yes, well, thank you both so much for sharing. I know I learned a lot in that brief amount of time. And I think one question that arises for me is we've heard a lot about grief and trauma, particularly in children. And so I'm wondering how both or either of you see the need for spaces of worship to respond to sea level rises and environmental inequities in general, and where you would want to see spaces of worship step in and respond.
Yeah, I can take that, Dr. Emery, and then if you had more to add. But certainly, after the flood, we saw a lot of faith-based organizations coming into our community and really helping families with mucking their homes and the cleanup. And I think, the most important thing, and I can only speak for my family, but obviously I've validated this with a number of other families, but I think the most important thing is just to show that you care. One of the things that was really frustrating for a lot of our families is that, once the hurricane had passed, Myrtle Beach was like, we're open for business, right? Tourists, come on in. And what ended up happening was that's when the flood waters really started to rise and all of our local roads flooded. So all of our major highways flooded. Governor McMaster had to take unprecedented steps to create an artificial dam just to keep access open to Myrtle Beach. And it created this huge backlog of cars. And so for families like me, we actually could not get out of our community because there was 6, 7, 8 hours of stopped traffic because there was only one way into the beach. And it really felt like nobody cared, right? Everybody was trying to get to the beach and enjoy their vacation with their campers and it just felt like nobody cared because the coast wasn't impacted. The media stopped covering the story. There was a few people that were covering like the rivers are going to rise. But it really just felt like nobody cared what our inland communities were suffering with. And so that, I think, just making sure, because you have to understand that that's the kind of stuff that we're seeing and that's the kind of stuff that we're experiencing. So you almost have to compensate for that lack of caring and compassion. And really, as a faith-based organization, I think that is the most takeaway that I could say is just being there, caring, offering support, and just listening and, giving hugs and all that good stuff. That meant so much to me. The donations, you know, it was amazing. Like, we were a family that would never have asked for help, but people in our lives just wanted to help because they just felt so sad for us and devastated for us. And so, you know, obviously just little things, you know, making us a meal or giving us a gift card, you know, those kind of little tiny things was just so sweet and so thoughtful. And I think, you know, making sure that we don't forget, you know, the impact that it has on children and doing those meaningful things for little children too. And so that would be my recommendation.
Yeah, first off, that was a fantastic talk, April. It was fantastic. To, I guess, add to that, I think, to me, I think you highlighted one issue that we all battle against is that when you look at adaptive and recovery methods taken from the outside the community, we miss the mark a lot. And that's where I feel like faith-based organizations, especially those in the community, can be that bridge where, you know, instead of, you know, someone in Columbia dictating how do we help in Horry County, we have members in Horry County to do so. Especially with mental health, touching on that we do have avenues available through the emergency recovery and everything else, but those end at some point. And they're, like we discussed, each family, each of those homes was 3, 4, 5 people. And each of those people needed access to care. And as we've seen with COVID, our healthcare infrastructure isn't designed for that, frankly. And that's where communities can step in and help. And faith-based community are just perfect for that. And that is a charge of my faith, of a Christian faith, is that we're there. It's faith in action. And if we don't take that action and we see it on the news or whatever, and don't take that extra step, then we're not doing our role either.
I have a bit of a follow-up question, and maybe this is more for April, but so I lived in the coastal area and experienced a lot of flooding, tornadoes, hurricanes this last year, and I didn't have a personal connection to the community. And I think maybe people here or people who are listening probably are in a similar position, that they don't have, you know, that family that they can bring dinner to or the gift card to provide, which is great steps in loving your neighbor. So I'm wondering, for people who are a little more disconnected but still want to help out in these areas, is there any advice you can give on timing of like when to go into the area to help, like things you can do if you are at a distance or anything like that?
Yeah, I mean, one of the reasons, you know, it's kind of funny, we created a Facebook forum, and it was a way to bring together the affected families, right? Because it was really hard to coordinate and figure out. And so we needed a place where everybody could come together. And so that morphed into, well, okay, we're all recovered now, whatever recovery looks like, because there really is no meaningful recovery after you flood. Now what are we going to do? And we're like, well, we got to stop this. You know, we got to mitigate. We have to protect ourselves. We have to protect our homes. We don't feel safe anymore. We don't feel safe in our homes anymore. We don't feel secure in our homes. The best analogy I can give is like a thief coming in and breaking through your house and stealing your most treasured items, and there's nothing you can do. And so it's a violation. It removes that sense of security that you're supposed to feel, that feeling of safeness in your home. So I think, you know, to respond to your question, it really depends on where you are in the process. You know, some families aren't going to want, you know, people in their houses. They feel so violated. And, you know, and so they might need more time. You know, other families might need help right away, and might not have a place to stay. So I think the most important thing is find out where those families are. You know, where are they meeting? Where are they coming together? You know, if there is no space to bring those families together, creating a space, and making sure that it's safe. You know, we have really pretty rigid rules in our Facebook group. If you're here to come help us and you care about neighbors that are flooding, great. Thanks for having, thanks for being here. But if you're going to come to our forum and, call us ridiculous and laugh at us and, all this, we don't want you. So I think you have to make sure you have really good boundaries around those kinds of things as well, to make it so people do feel safe, because there's just so much of that already after you flood that you lose. So yeah, I think, each individual family is different. We just in my family alone, how we kind of needed help on certain things, but didn't need help on other stuff. And so it's really hard. I think if you're new to a county, and one of the great things that you can do to prepare for hurricane season is to find out where those areas are affected and find out where people are, because I think that's a really important. We have lots of folks that come to our group to find out where the flooding is in OLeary. So when there's an event, we have lots of folks and they're like, what can we help with? Which is really, really cool, but they don't really follow us and engage on anything else, right? They just come either ahead of a major event or during an event or after an event. So yeah, that's really the best suggestion that I can give.
Great, thank you. Are there any other questions from our participants? I have some more to offer, but wanted to give you guys a chance to ask our wonderful panelists.
I have a question. I was just about to type it, but I think it's easier for me just to ask both of you. And I guess starting again with you, April, you were in a different line of work, and this kind of was, I guess, your catalyst to switch to this role that you have now, leading this amazing organization. For many of us, even having that, desire to do something comes along with like fear and apprehension about whether or not, you are going to be successful and going to be effective. So do you have any advice, or can you, I guess, kind of in, a few minutes, kind of walk us through how you made that leap from, your previous occupation to realizing there was a gap and something needs to be done, and you taking on that leadership role? And then the same for you, Brandon. So I know that this is a new organization, South Carolina Health Professionals for Climate Action. If you could share with us kind of, how you were able to, in your already busy schedule, find the energy and the drive to be able to really lead the development of this organization, South Carolina Health Professionals for Climate Action.
Well, there's a couple tricks. They're really tricks. You fake it till you make it, right? So there's a lot of fear, and you have to acknowledge that, and then you have to just face it head on. I'll never forget, signing up for public input at that first county council meeting, or speaking to my mayor for the first time. My knees were shaking, my hands were shaking. I could hear my voice crackling, but you get used to it. And as you form those relationships and those connections, it becomes easier. And so, but truly it is knowing that there are families that are suffering, that are worse off than me, that really propels me. To me, I'm just going to be straight up honest with the event in Tennessee. Like, I immediately went to, how does that happen? How do we have that many lives lost? That is unacceptable. So oftentimes I go through a step process where we're dealing with an event, and I say, no lives lost, win, right? And then I get to, okay, how many homes have been inundated? Do they have temporary shelter? What are their needs and stuff? And so then we start trying to figure out those needs. When, right? So you just kind of go through, and that's really the best way to kind of go about it, is like a step-by-step process. It is so easy to become devastated and just sick with grief. I was sick with grief when I saw what was happening in North Carolina and Tennessee just this week. And I was thinking to myself, how does that happen? How does 7-month-old twins get washed away from their father's arms? That's just unacceptable to me and just breaks me. And so that's what I'm trying to prevent here. That's what I'm trying to prevent in Horry and trying to prevent in South Carolina. Number one goal always. Then we can move on to property and those kinds of things. So that's really, really important, is to face that fear, because that's why, right? There are people that are dying. We had a family of 5 that was washed away in a flood event, and thank God there were officers there, or they would have drowned. And so the risk is real. The threat is real. It's about people's lives and livelihoods too. And so it really helps me to face that fear. And then I think, the other thing that I would just recommend is that you have to rely on each other and other victims. And the third thing that I would recommend is you need to ignore the people that are not on your side, that are not going to support you. If you have something meaningful to contribute to this cause, we want you, we love you. Thank you. Thank you for caring. If maybe you're only slightly inconvenienced by flooding, where you can't get to work maybe a couple days a year. Maybe you're not affected at all, but you have somebody like those are the kind of people that we want to connect with, because it's a small portion compared to the general population. But if you don't care and you're not contributing in a meaningful way, we don't want you. And I just ignore that, because it distracts me from my mission and my goal and my focus, which is these families and these communities. And so oftentimes a lot of people like to do that banter back and forth. I'm not one. I think it's a complete waste of time. So.
That's great. I am very similar. I think you focus on the why aspect of it first. I got involved with South Carolina Health Professionals Climate Action right around the same time with COVID. And at that moment, I was also turning 40. So I kind of had an existential crisis just in general, and really focused on the why of what I was doing. And that in itself can be a motivating factor, right? That it's difficult, today to work, from 8 till 6 or whatever, and then get on here and do this, and you're tired, but there's a why behind it, and it's meaningful. And that why is to really just be a catalyst to make the world just better, right? And that if we're not contributing to the society, we're not doing our role. The other part, when I kind of get down or whatever with that, is just realize it was one of the Stoic philosophers, but said it's not that we don't have enough time, it's just we waste a lot of it. And I try to remind myself at home that if I spend 30 minutes on YouTube, that's 30 minutes I could have spent doing something else. And it's not that downtime isn't important, but at the same point, when we say we don't have the time, we don't have the energy, we do. We're just putting that into something else. And when you clearly define what your values are, what your whys are, it becomes shifting that time and shifting that effort much more easy.
Thank you. Both of you are such powerful lights, and I think the work that you're doing is, like you said, a catalyst for so many of us who see the challenges but maybe don't know how to engage. Marjorie, were there any other questions?
Yes, there were. One of them being, what do you see as a necessary next step for faith communities in South Carolina to take in order to prioritize climate change as a wide topic and flooding specifically?
So I'll give April a break. I think this one really comes down to redefining the question and the consequences of climate change, where first charge is removing it from the political arena, where just the mere mention of climate change already has connotations associated with it. And part of moving that conversation forward is what we're doing here, right? So looking at climate change not by what is the impact of taxes, or what is the impact of the government control, whatever the solutions are, we have to start with the problem, which is more than just this distant issue that we don't have ownership of, right? That, if we look at climate change as the flooding in Horry County, if we look at climate change like the extreme heat and the athlete, then taking ownership of correcting that and being involved in the solution, I think, is much easier for the faith-based community. Second, I think too, is defining the values, right? That, like we're saying, is the greatest commandment, love God with all your heart, but also love thy neighbor as yourself. And that is difficult sometimes, but it's important to do, right? That it may be, the time that we talked about before, it may be the taxes that become in the political arena, but at the same point that we're charged by our faith to be there and to be that person to help our neighbor. And that neighbor may not be the one that goes to your church, or may not be the one literally next door, but it's the ones in our community that we need to be involved with.
That was a beautiful job. I would just add, it's a visual thing for me, but I envision myself as a shepherd or a guide. And I think that is the number one way that faith-based organizations can really help, by being a shepherd, being a guide, helping these families go through the event and being there, holding your hand, just being a shoulder to cry on, a phone number to call, a meal to eat, and helping them guide through it. Because I can tell you, we're vulnerable, we're feeling really vulnerable. We watch meteorologists more than we watch, any sort of new hit show on Netflix or new, the meteorologists are who we watching. What does the rainfall forecast look like? How is that going to affect our rivers? What is that going to mean for this community and that community? And when is it going to happen? And is this a flash flood event, or is this a storm surge event, or is this a riverine flood event? Because there's so many different types of flooding and different types of impacts, and then obviously the community needs to drive the solutions. It cannot come as a top-down approach. It has to be driven by the community. And Horry County Rising, that is one of our number one values. What works in Myrtle Beach. And in that case, the community drove the solution and said, we want to buy out. We want out of here. We don't want to live in this neighborhood anymore. But in Bucksport, which is predominantly an African-American community, they are culturally and emotionally connected to their land. They don't want to move. And they want us to fix the flooding, right? And so we needed to do an infrastructure there. So I think making sure that the community is driving the solution, but also being a guide, through that, a shepherd through that, helping to facilitate those conversations, making sure that the community does have a voice. Because I can tell you, when you're rebuilding your house and you have all these other things that you have to worry about, you need a guide. You need someone that you can go to that's going to either be your voice for you when you can't be there, or be a shoulder when you need a shoulder. And really make sure that the community's needs and the community's solutions to the problems are in the forefront. Otherwise, we get bulldozed, right? And the government just responds and says, okay, we're going to do this project, that project, this, and there's no meaningful things. So we did things like focus flood groups and sessions, and we went to each affected community and things like that. We did interviews with all our families. Many of them, we've spent hours and hours on the phone with them, so trying to really understand their experience and what they went through, what they spent, and then all the other sort of secondary causes as it relates to flooding. So that, I think, just being a guide is a really great role that any faith-based organization could play.
Great. Thank you both so much. Those are all the questions that I have received. So if there are any other from the audience, now's your time.
Hi, I'm Susan Lyons. I live in Charleston. I know April. I am continually impressed with her. I think she's doing an amazing job up there. We are working in Charleston. Thank you, Dr. Emery, for using Charleston as your example. We're working here to build community engagement, which our political body resists. Charleston's a wholly different construct, I guess, from the Horry County communities that you're talking about. So we are at the moment dealing with the Army Corps of Engineers that wants to put a big 12-foot wall around the peninsula to stop surge. And that, even if it does engender support, which it hasn't yet, and even if they could raise the billions, which they haven't even begun to talk about, wouldn't happen for somewhere between 8 and 15 years. So this is a community at great, great risk, which is by and large and still in denial, because Hugo came and went, and the 3 big episodes came and went. And very often the powers that be around here say things like, well, Charleston always floods. But when you speak about those communities, the African-American communities and the low-income communities on the edges of fancy Charleston, they have been ignored continually. And we pushed very hard for a citizens advisory group to go kind of be a watchdog over this Army Corps process, with the idea of bringing in other projects and creating a better mitigative effort. But it is slow, and there is tremendous resistance to anything that as citizens we have to say. So I was wondering how you all, if you do, move the political body. And of course, money comes first in their minds, but the political system here is not responsive, and the development goes on apace, and it's totally counterintuitive to what we're seeing out there. I was just curious how you've been able to be so successful with that.
Oh, well, Susan, it's so great to see you. And when you signed on, I was so happy you were here. The solution, so it's funny, flooding is very complicated. And so anytime, an issue is complicated, a confused mind never buys, right? So you're not going to get politicians to buy into anything you're doing if they're completely confused, because it's so complicated. Right. So that is the number one, right? So you have to start with your recommendations, your solutions. This is what I want you to do, and make it really clear. But beyond that, really the only way to motivate a politician, and we defined the solution to flooding as a political one, because unfortunately that's just the reality that we're in. So the solution to flooding is a political one. So we created a large enough base where they had no choice but to listen. So if you carry enough voters, whether those are people that are affected, whether those people are inconvenienced, whether they know somebody that was affected, or they're just genuinely empathic and compassionate, we're trying to reach across all of those things. And we're trying to make sure that the solutions are simple, that the messaging is simple, right? Don't build in the swamp. Well, what does that really mean? That means we're increasing our freeboard. It means we're addressing fill in the floodplain so we don't increase flood risk on flood fringe areas. It means we're not going to invest any of our critical facilities in the 100 and 500 year flood zone. That's what don't build in the swamp means. So we provide that. We provide you with details. We give you infographics for those that would prefer a graphic of what does no net fill mean, right? Because that's complicated. So I think, making sure that your messaging is simple, your solutions are simple, but also making sure that you do provide the technical side of things. So it's real clear too, for those that are policy wonks like me. And then you mobilize your base and you hope and pray that it resonates with them, that they will take action. You hope that people are not affected or not inconvenienced, that they'll take action. We were really lucky. Our council was waking up to hundreds of emails every single day because we had the right message. We had the right campaign. we had the right ask. I think also making sure that they have input along the process before or while you're building your campaign. So we asked our members, we wanted their input. Do you support a 2-foot freeboard? Do you support a 3-foot freeboard? Or you want things to stay the same? Those kinds of things. So, bringing them along in the process. And then I think creating opportunities for people to connect with one another. We call them rising roundups, but we would just get on Zoom and rise everybody up. And we would say, okay, what's your talking points for council? And, when's the last time you emailed folks? And what do you need? How can I support you? We also did yard signs, and we also did door-to-door campaigns. So we made sure that we went out to areas, especially on the corridors leading into the county, because a lot of our highways had flooded. So I think, it's a wraparound community approach. It takes a lot of different angles to approach this. And it's a marathon, not a sprint. And so there's been a lot of losses and a lot of tears, but also a lot of wins and a lot of success too. So hopefully that helps.
It does. Thank you. You're high energy. That's great.
The only thing that was great, that I would add is that coming at it from a climate change perspective, we're already entering into the fight kind of handicapped with that. But it's the framing of the issue, I think, that gives us more ground to come in with a public health concern, to come in with a direct adaptive method concern for flooding or from heat exposure or whatever. To come in with a clear target for an adaptive measure is much more palatable than to tackle the big issue of climate change. Right. And from our aspect, and my opinion is that the adaptive measures for climate change is best done, like April's doing, by the community, right? The mitigative action for climate change to reduce emissions, that's a federal policy question. And our role in our organization is more to educate that this isn't a political topic. This is a public health topic. This is your child's topic. Second is looking at, like she said, values. I think is really important in that I am a cynical optimist, but at the end of the day, I like to believe that we have some overlapping values and that we can at least agree that child health and well-being is important. So let's use that as a jumping off point. And the third issue with how political climate change has become has more to do with the proposed solutions than the topic itself. So for example, whenever we look at what are the measures for adaptive or for mitigative action, if the solution isn't palatable to a Republican bend, then the knee-jerk was the problem didn't exist. And that's been something that we've been battling, is that just because the solutions aren't to your liking, that is fine. That is what politics and public discourse and debate is for. But you must enter into it knowing that the problem is still there. If you don't like the solutions, we can talk about the solutions. We can come to a public and private collaborative method to find this adaptive mitigative. But don't ignore the problem just because you don't like the proposed solutions.
I think that's what they do here. Big time. Thank you. I have to run, but it's lovely to see you, and it's inspiring to hear you speak, because we get all embroiled in Charleston and in what I call administrivia. And, you can drown in that. I wish you dry feet and good times. Great to see you, April. Nice to see you all, and thank you.
Thank you for joining us, Susan.
Thanks so much.
And thank you again, Brandon and April, for just a wonderful conversation. So many practical ways, actions that we can take as people of faith. And we're going to close out with one last opportunity for all of our, family and friends, all those really throughout the world who want to help with mitigation through a project that South Carolina Interfaith Power and Light will begin next month. So Marjorie will close us out with information about that.
Yes, thank you. So SCIPL is embarking on a global tree project to address deforestation and climate change. To us, it feels really necessary to address these issues globally and locally, and we believe in the power of trees and want to help our neighbors and through the state and through the world through its healing and purifying qualities. So we will be taking 4 weeks to address 4 different places: Pakistan, the SC Gullah-Geechee Nation, Trinidad, and Haiti. So make sure to follow SCIPL on all of our social media platforms and get on our newsletter so that you get all the information on how we're going to be collecting donations and just learning more about how we can mitigate issues all surrounding climate change, and hopefully using tonight as a jumping off point to really, I don't know, put some stories to why we're doing what we're doing. So thank you both so much for sharing and just shedding light on what's going on in our state. And I know that it will leave an impact with everyone who attended tonight and who watches in the following days.
Have a good night.
Thank you, everybody.
Sharing.